そうね。Okay, Wonders of Medicine, Unit 1, Part 1, Basics of Drug Therapy, Receptors of Drug Targets. Physiology means that the branch of biology that deals with the functions of living organisms and their parts. Pharmacology means that branch of medicine concerned with the uses, effects, and modes of action of drugs. Toxicology means that branch of science concerned with the nature, effect, and the detection of poison. Immunology means that the branch of medicine and biology concerned with immunity. Bacteriology means that the study of bacteria. How do drugs actually work? Scientists have long tried to answer this question. They eventually realized that in order for a drug to exert its selective action, human cells must have a site for the recognition and acceptance of a specific type of drug. This side of the drug action is termed a receptor. Drug-receptor interactions have now become the focus of research for the development of new drugs. It was Paul Ehrlich, a German chemist, who first proposed the concept of receptors. His observation of drugs used to treat parasitic infections led him to conclude that each cell will have characteristics that allow it to recognize particular molecules. He proposed a key hypothesis, that is, that a drug binds to a receptor in the same way that a key fits into a lock. This was based on his belief that the drug and the receptor must be structurally complementary in order to recognize each other and initiate an effect. Receptors, which are primarily the targets of the majority of drugs, are biological molecules that have evolved specifically for intracellular communication. This type of receptor includes ion channels and proteins in the plasma membrane. Basically, the biological function of these receptors is to respond to the body's own endogenous chemical messengers such as hormones or neurotransmitters. When binding takes place, it triggers a series of biochemical and physiological changes known as a response. Other types of receptors are the macromolecules, which are essential to a cell's normal function or replication, such as enzymes, lipids, or nucleic acids, particularly DNA. Drugs which bind with the receptors and mimic the effects of hormones or neurotransmitters are called agonists. Drugs which bind to the receptors but do not have the unique structural features necessary to activate them are called antagonists. Since antagonists occupy the binding side of the receptors, they prevent activation by agonists. Advances in the sequencing of the human genome have enabled researchers to identify the structures and varieties of receptors. Many newly discovered receptors have become potential targets for the pharmaceutical development. G-protein coupled receptor (GPCRs) and ligand-gated ion channels are two of the most important receptor types now being targeted in the quest for new clinical use for drugs. Unit 2, Routes of Drug Administration. Tongue, esophagus, sublingual, inhalation, intramuscular, intravenous, subcutaneous, liver, heart, lung, stomach, small intestine, large intestine, rectal. For pharmaceutical agent to be effective in carrying out its selective action, the drug must be administered in an appropriate manner. Each route of drug administration has specific purposes, advantages, and disadvantages. Oral route. With this method, drugs formulated in liquid or solid form are absorbed into the body from the gastrointestinal tract (GIT). This is the most commonly used route. Oral drugs are convenient, portable, painless, easy to take. Also, administration can be carried out by the patient him or herself. However, the onset of the drug's effect is relatively slow. To sublingual route. In this case, the drug, usually in tablet form, is placed under the tongue. This produces a very fast onset of drug action because of good blood supply to the area, but the duration of the drug's effect is usually short. The electro route. This method can be used for patients who are unable to take drugs orally, or with younger children, elderly, or mentally disturbed patients. This route is useful when a drug is known to cause GIT irritation. However, absorption is often incomplete and effectiveness is uncom- unpredictable. For injection route 1, subcutaneous CS route, there are few blood vessels in fatty tissue just below the thumbs, so absorption is slow but usually complete. This route is suitable when slow and continuous absorption is required, as with the insulin or RG shot. To intramuscular IM route, since large muscles are well supplied with blood vessels, drugs is aqueous solution are rapidly absorbed and produce a very fast onset of action. However, for IM injection, medically trained personnel are required, whereas gas injection can be done by patient. Three intravenous route. Through this route, the drugs are injected directly into the brain, therefore directly into the systemic circulation. This method produces very fast onset of action, and the therapeutic effect can be seen immediately. On the other hand, toxicity can be caused when high concentrations of the drug are delivered too rapidly. Consequently, the rate of infusion should be carefully controlled. Inhalation: drugs inhaled through the nose or mouth are particularly effective for patients with respiratory problems such as asthma, as the drugs are delivered directly to the site of action. Systemic side effects are minimized. In addition, since the drug dose necessary to produce the desired effect is much smaller than that for the oral route, side effects can be reduced even further. Topical route. Topical drugs are applied directly to the skin or mucous membrane of the eye, ear, nose, or mouth. This method is employed when the local effect of the drug is desired. Unit 3: Drug Development and Approval. Compound concepts promising 見込みのある conventional method 従来の方法 trial 試験 prescribe 処方する conventional method, a way means that the way of doing something that has been used for a long time and it's considered the standard. Compound some means that something that consists of the combination of two or more parts, quality or etc. Promising means that showing signs of being successful in the future. Prescribe means that to authorize a particular drug or treatment for a patient, usually by a physician in writing. Trial means that a process of testing to find out whether something works effectively and is safe. How do how much do you know about clinical trials? For example, do you know how long it takes for a new drug to be approved? Once a new compound has been identified in the laboratory, it undergoes a lengthy process before it can be marketed for public use. The entire drug development process can be summarized as follows: preclinical testing, investigational new drug application, clinical trials, new drug application, NDA, and approval. During preclinical testing, a pharmaceutical company conducts laboratory and animal studies to test the effectiveness of the compound against the targeted disease. Preclinical testing also determines the safety of the new compound and studies the physical and chemical characteristics of the new drug substance. These tests take about 3.5 years. After preclinical testing, the company files an IND application with the U.S. Food and Drug Administration (FDA) for permission to begin human testing without objections. Tests begin within 30 days. Clinical testing starts with phase 1 studies on 20 to 80 healthy subjects. The safe dosage range and how a drug is absorbed, distributed, metabolized, and excreted by the body are determined. These tests take about a year. In phase 2, the potential drug is first tested on 100 to 300 patients suffering from the targeted disease. This takes about 2 years. If a new drug looks promising, phase 3 with 10,000 to 1,000 to 3,000 patients is started. It tests the therapeutic outcome of the new treatment compared to conventional methods. These human clinical trials are subject to strict review and approval by institutional ethics committees. This phase lasts about 3 years. Ultimately, only about one new drug ever emerges from some 10,000 newly synthesized substances. After the clinical trials have been completed, the company analyzes all of the data, and if the data is positive, files an NDA with the FDA in 1997. The average NDA review time for new substances approval was 16.2 months. After this approval, physicians are then free to prescribe the new medicine. The drug manufacturer must continue to submit periodic reports to the FDA. They include the appropriate quality control records and information on any cases of adverse reactions. For some medicines, the FDA requires follow-up trials to evaluate long-term effects. Developing safe and effective new medicines is a long and expensive process. The 11 to 13 years it takes on average from laboratory to pharmacy has led to greater pressure by patients who know they cannot wait for treatment. For these patients, speeding up the lengthy process is indeed a matter of life and death. 病に胸中を全せず、善による、善に似て善ならず、 王に似て王ならず、越に似て王越ならず、善に似て善ならず、心中徹して、快快善として、いかんともなきものは、消去半下とこれを司る。消去半下、右にみ。水三升持って煮て半下二升取り、小京汁を入れ煮て一升半を取り、少しく冷やし、分かち四服し、日に三服す、夜に一服す、やめば五服をとどむ。漢をし、もして足消するものは、収束消するものは、吉脾とこれを司る。吉脾との方、吉脾、消去、右にみ。水七升を持って煮て、三升取り、おかち温め一服す。一升を音服す。喉を下れば、すなわち湯。越逆のものは、吉脾、畜生、運多と、畜生と、これを司る。吉脾、畜生との方、吉脾、畜生、大祖、小居、肝臓、人参、右六味、水一升を持って煮て三升取り一升音複数、日に三複数。それ六分の木、外にたゆるものは、外にたゆるものは、主足冷え、長期して、脚縮まる。五層の木、うちにたゆるものは、利禁せず、下ることはだしきものは、主足不尽す。下痢して脈地弦なるものは下重す。脈大なるものは山ざる。未だ山ざるとなす。脈微着作なるものはおのずからやまんと欲すとなす。発熱すといえどもしせず。下痢、主足、血冷。脈なき者は、これを吸し、温まらず、もし脈帰らず、かえって微然する者は死す。小陰、不要、まくる者は、順となすなり。霧、微熱ありして、下し、脈弱なる者は、今、おのずから言う。下痢、脈索、微熱あり、簡易で、今、おのずから言うるは、もし脈金にして、いまだ回線となす。 下痢、脈、索にしてかつ、今、おのずから言う、シムは、もし、言えざれば必ず、脳血あるをもってのゆえなり、脳血を制す、熱あるをもってのゆえなり、下痢、脈、かえって現、発熱、心関するものはおのずから言う。して脈かえって現、発熱、み、汗するものはおのずから言う。これは名文だな。をして発熱するものは詳細ことはつかさどる。召喚、体感、大いにこれを下し、疲れ、清めて、虚し、未だ、召喚、大いに年、大いにこれを下し、清めて、虚し、服、清めて、また清めて、間いずるものなり、また風水を与え、